In this lab, we'll take a look at the 8 cranial bones. So we have one bone that makes up most of our forehead. This is called the frontal bone. This flat portion right here, you're going to call the squamous portion or the squama. There's a ridge of bone right under your eyebrow. If you kind of palpate your eyebrow area there, you'll feel a thickening. This is known as the supraorbital margin. Between the supraorbital margin, you'll feel kind of a raised area here. This is called the glabella. Now, this is the orbit with the eye removed. On the lateral part of the frontal bone, if you stuck your finger into the orbit, you're going to feel a shallow depression. That shallow depression holds our tear gland, known as the lacrimal gland. So the tear gland is sitting in this lacrimal fossa. A fossa is a shallow depression. So here is our model. You can see the frontal bone here. All of this flat part would be the squama. Here's the supraorbital margin, that kind of ridge right there, the glabella. Then under here, we could see it a little bit better. All of this kind of shallow depression, all in here is where the tear gland would sit. So we call this the lacrimal fossa. Now, our frontal bone has a hollow cavity in here known as a sinus. We can't see it on the intact skull. So what we have to do is actually cut the skull and take a look. So here's a model where you can see that this is the squama, right? The squamous portion of the frontal bone here. Look right behind it. This cavity would be the frontal sinus, and that sinus opens up into the nasal cavity here to humidify the air, to moisturize the air. The next bone is the parietal bone. We have two of them. There's one on the right and there's one on the left. For our lab, there is no landmarks that you have to know. You just have to know the right and the left parietal bones. So this one happens to be the right parietal bone. From a back view, this is the right parietal bone, and then this one would be the left. Here it is on our model. Again, right and left parietal bones. And so we have one frontal bone and two parietal bones. Again, another one on our model. The next bone is the occipital bone, or sometimes we call it the occiput. There is one occipital bone. So this bump right here is the first one I want you to find. This is called the this is called the external occipital protuberance. We usually abbreviate the EOP. Coming from the EOP, kind of going out laterally, this is going to be the superior nuchal line. Nuchal means neck, and this is where some of our neck muscles are going to attach. And then you'll see underneath it the inferior nuchal line. So here's our skull model. Again, find the EOP. This kind of ridge of bone right here, all of this, it's a thick ridge. This is called the superior nuchal line. Then go down about a ½ inch roughly. This will be the inferior nuchal line right here. And all of these nuchal lines are for muscle attachment from the neck. All right, so EOP, superior, inferior nuchal lines. Now on this image, we turned the skull upside down, and here can locate the EOP. Always make that your landmark that you want to find. Then follow the EOP towards this big hole down over here. This big hole we're going to cover in a separate lab. There's a ridge of bone right here. You're going to call this the external occipital crest. Once you get to that big hole, you can run your fingers to the left and to the right. You're going to feel two curved, smooth bones known as the occipital condyles. Just so you know, condyles are going to always form a joint. They're going to be forming a joint. So these occipital condyles are actually going to sit on our first cervical vertebrae known as the atlas. So again, on our skull model, find the EOP. Run your finger down towards the big hole, right? This is going to be the external occipital crest, and then you can just run your fingers on either side of that large hole. These two curved bones here are the occipital condyles. Okay, that's our occiput. We have one occiput. The next two bones are the temporal bones. temporal bones. So this whole flat part right here is known as the squamous portion. Squamous means flat. Then this part right here is the zygomatic process. This is forming the back part of our cheek arch, right? This whole thing would be like the arch, the zygomatic arch we call it. The back half is formed by the zygomatic process. This word process is like an extension of bone. So you can see this bone kind of extends forward here. So squamous portion, zygomatic process. Here's another fossa. This shallow depression right here, this whole shallow depression, allows for articulation with our jawbone known as the mandible. So this is called the condylar process of the mandible. We'll do that in a separate lab. That's going to articulate with this shallow depression right here, forming something called the temporomandibular joint. We sometimes just abbreviate that to TMJ. Okay, so what you want to look for is the shallow depression right here, the mandibular fossa. We're going to cover this in a separate video also. This is the ear canal. Behind the ear canal and inferior, this big bump right here is called the mastoid process. And then just anterior to that in the front, you're going to see like a little stick protruding down. This is called the styloid process, right? Just like a stylus you would use when you're touching a computer or a tablet. Now, these are all external features that we can see of the temporal bone. The last feature that I want you to be able to see is going to be called the Petrus portion. This is seen from the inside. So take a look in here. There's this triangular area here going over to here, all of this triangular area, and you can see it's raised in the middle, kind of like a mountain range. This whole portion here is called the Petrus portion of the temporal bone, and we can see it nicely over here too. You get this whole triangular area here, and you can see it's raised up right there. This is the Petrus portion. We can only see that from the inside. So let's review the things we can see from the actual skull model. Squamous portion, extending forward zygomatic process. Again, this shallow depression right here is the mandibular fossa. The big bump behind the ear, mastoid process. And the little stick coming down, styloid process. Those are all seen from the outside. From the inside, this whole triangular area, all here going over to here, big triangle, and it's raised in the middle. That is the Petrus portion of the temporal bone, and we're going to see down the road this is where our inner ear structures are located. So we have two temporal bones. Okay, so we did one frontal bone, we did two parietal bones, we did one occipital bone, that's 4, and then we did two temporal bones, that's 6. The 7th bone is the sphenoid bone. So you can see here all of this blue is the sphenoid bone. Kind of fills up most of the middle cranial floor. So the sphenoid bone, this whole middle area is called the body of the sphenoid. I didn't label it, but this would be called the body of the sphenoid. The thing that I'd like you to know up top, there's a shallow depression right here. This houses a gland called the pituitary. So right where my cursor is right now, that's where the pituitary would sit. That whole structure is called the sella turcica. Sella turcica. And then we have two wings of the sphenoid bone. This big wing right up over here is the greater wing. And then this one over here, all of this here, and you can see it on the other side. These are the lesser wings. So on our model, and kind of forming the whole middle cranial floor, this is the sphenoid. Here's our sella turcica, greater wing, lesser wing. We want to be able to identify that greater wing because there are some holes in here that we need to identify, and we'll do that in a future lab. Now, hanging down from the sphenoid bone are two downward projections. So this and this are known as the pterygoid processes. We see them from a different view. And I also want to point out, if we cut the body open, we'll see there's a hollow area known as the sinus. So this is another sinus. We had looked at the frontal sinus before. This is the sphenoid sinus or sphenoidal sinus, but we would only see that if we cut into the body. So what I did was I took again, that same model that had the frontal sinus up over here. Here's the sphenoid bone cut. This whole area would be the body, and this hollow area here is the sphenoid sinus or sphenoidal sinus. Right above it, here's that cup, that little cup right there. That's the sella turcica, and that little pinkish gland right there is the pituitary gland. So the downward projection we can see from the posterior view on the underside, this piece of bone coming down right here and right here are the pterygoid processes. And then you'll see there's two plates. This is the medial plate of the left pterygoid. Here's the lateral plate of the right pterygoid. The eighth bone is the ethmoid bone. This one is difficult to understand sometimes. I love this picture here. This really shows you how the ethmoid bone fits into our cranium. You could see the top part of the ethmoid bone is facing the cranial cavity. The bottom part of the ethmoid bone is in the nasal cavity, so it's kind of in between. Right, here's that same picture, just kind of cut. So here we see the whole ethmoid bone, right between our eyeballs. The top part is in the cranial cavity. The bottom part is in the nasal cavity, right over here. So the part we could see from the cranial cavity is this whole green area. This whole outline right here, and with the green all in between, this whole floor is called the cribriform plate. Then extending up is a ridge of bone called the crista galli. So if we go back to this picture here, this would be the cribriform plate, kind of running right across here, and then the piece that sticks up is the crista galli. Same thing, here's like the cribriform plate, and then sticking up is the crista galli. Here it is on our model here. So again, all of this would be the cribriform plate. Everything in here is the cribriform plate, and then extending up from the cribriform plate is the crista galli. Now the remaining part of the ethmoid bone we're going to look at from the nasal cavity. So this piece of bone coming down right here is called the perpendicular plate. This is forming like the upper half of our nasal septum. That's the wall that separates the left and the right nasal cavities. The facial bone, we'll talk about this in a separate lab, forms the lower half of the nasal septum. That is called the vomer. The other thing that we're going to see is there's two scrolls up over here that are part of the ethmoid bone. What we're actually looking at is the middle nasal concha, and if we were able to dissect it and look in there, we would see there's a little one above it too called the superior nasal concha. So we're kind of seeing both of the nasal concha from the front here. So this is going to be called the superior and the middle nasal concha. If you just even put middle nasal concha, that would be okay, because that's what we're seeing predominantly. That's even the way I labeled it on this next slide here. So here's your perpendicular plate. Here's your middle nasal concha. Again, if we were to able to look in there, we would see there's a superior also. We can't see that. This inferior nasal concha is a separate bone. This is a facial bone. We'll do that in the separate lab, as well as the vomer. But here we could actually see the entire nasal septum. Okay, so this is the perpendicular plate, and then the middle nasal concha. The ethmoid bone also has a sinus. This is a model where we cut through the face in a frontal section. So here's actually the nasal septum right here. And here's our nasal concha right here. And here's the one eyeball. Here's the other eyeball. So this little hollow area right here, and we catch a little bit of it right in here. These would be the ethmoid sinuses. So the bones that have sinuses are the frontal bone, the sphenoid bone, and then we're seeing it here on the ethmoid bone.